It's Michelle from Resurgence Neuro Rehab, and I'm here to make a video that I've really been hesitating about making because we had an unfortunate announcement which has honestly broken my heart, but it is what it is. So I'm here to just kind of talk a little bit about it because basically everybody's asking what happened. Um, in my social post, I said it came suddenly. And so there's a lot of working parts into this business. And I started out in 2023 really wanting to create this space for multidisciplinary practice. I never set out to do this on my own because it is too much work for one person to do on their own. And so I got this bigger space, tripled my overhead, and gambled because that's what business owners do, right? We take risks, we gamble. The incidence and prevalence of neurological disease is only going up. And after working in this healthcare industry, in the rehab part of the healthcare industry, I know that there is not a lot of great places to work. So I was wanting to create that as well. And so, I expanded, and it took me a long time to find staff. And when I found staff, I couldn't keep them. Was it the pay? Kind of. I can only pay out as much as I can get in, but even then, right, I have to make enough money to pay for the overhead. And so I had been posting videos, and not because I'm whining. Some people thought it was passive aggressive or me complaining, but it's not. I really feel like the insurance industry and the healthcare industry does need a makeover. And so it wasn't me griping. It was really truly me trying to help you all advocate for yourselves with the healthcare industry. So insurance reimbursements have been going down. They've gone down 12% since I've opened, and they went down another 3% this October. So we're fighting that. Plus, everybody knows that the cost of everything else is going up. And so it was a challenge, and we were already teetering on the edge of closing, and I was trying so desperately to save the business. I was trying desperately to save Resurgence Neuro Rehab because it is my dream. It's been my dream. My dream is creating this space, this beautiful space. And so what happened is the month of October, we had a ridiculous amount of cancellations. And my staff doesn't get paid when you don't show up. And so everybody left because they couldn't schedule themselves here. I had 2 staff members that were driving for over an hour to come here to work, which is a huge compliment and very much appreciated. But when they drive here for an hour for all their patients to cancel or not show up or try to reschedule, they couldn't do it. And I really don't blame them. And so, my last person resigned Halloween. And there's just no way that I can, first of all, that I can see enough people by myself to hold this space. I've been trying to hire a physical therapist for 2 months. I've been trying to hire a full-time occupational therapist since last June. And it's just been such a struggle. I am a small business. I don't have enough collateral to take out a loan to have enough capital in order to finance therapists to sit here and wait for people to show up. It's not a feasible business model. So, there's no way that I could see enough clients to hold the cost of operating this space by myself, first of all. Second of all, I was already spread thin, trying to do all the things. So I had hired an SLP to help me see my patients so that I could run the business, essentially. And so I was doing all the billing, all the scheduling, all the marketing, all the finances, and just trying to do all the things on the back end. Because we weren't making enough money to support an admin staff. I had to let my admin staff go because of the reimbursements and the consistent no-shows and lack of referrals. But Um, we got 8 referrals the week after the Michael J. Fox Foundation. So it wasn't lack of referrals. It was honestly the fact that the people who were scheduled weren't showing up when they were scheduled. For instance, today I came in with back-to-back clients. I had 7 clients scheduled, which is a lot for me to do everything else. And one person rescheduled, one person no-showed, and one person canceled. I don't get paid when people don't show up. So it's not sustainable. And I cannot, there's only so many hours in a day for me to work. And I was already working, 60 hours a week, taking work home and working on it and just being so depleted and so tired and so just exhausted. Mentally, physically, emotionally, just scrambling, trying to keep this alive. So when my last employee resigned, I threw my hands up and I said, you know what? I can't do this anymore by myself. I certainly can't stay in this space by myself, and I can't see all these people and hire still. I don't have time for interviews now. So we need to be done. And I had to make that call, and it was really sad. It's not what I wanted to do. Losing this business is not what I wanted. It is not anything that I foresaw. And I'm really appreciative of all the people who regularly attended therapy and who showed up when they were scheduled, and all the physicians that put their trust in us here. And I hate that I am not taking orders right now, because I do feel a strong pull to help people in this community. And I feel like I had something that was just doing an amazing job. But it doesn't matter where my heart is. It doesn't matter how much good I'm doing. Duke Power, City of Concord, the landlords, my mortgage company, they want to get paid. They don't care if my clients are sick or if they had something better to do or if they had family in town, or they don't care. I still have to pay for the overhead costs, which are twice as much as residential, by the way. I wasn't anticipating that, but anyway, so it really just comes down to the fact that the business is no longer financially viable. And I've told people I am not ashamed. And again, this isn't me complaining or looking for sympathy. This is me trying to express the reality of the situation. I really haven't paid myself in 4 years. I don't know how many people would work 60 to 70 hours for 4 years without getting a significant paycheck. And I did. And over the summer, I had a conversation with my husband and said, I can't do this if I don't get paid. I love what I do. I love what I created. And I love helping people. But at the end of the day, Michelle needs to make money to contribute to her household. But instead, it was costing me because I would have to pay out of my own pocket to cover the overhead because I wasn't getting enough attended therapy appointments. So I just, I am trying to figure out what to do next. And I know that I have left a lot of people upset and sad. I've let a lot of healthcare providers, I feel like I've let them down, which doesn't sit well with me. If there's one thing that I never want messed with, it's my professional integrity. And it's been kind of difficult for me to make peace with. I will say that, because again, this is something that I really wanted. I really wanted to accomplish, and I felt like I was succeeding. I just didn't have enough capital to put into the business to make it successful as fast as it needed to be successful. So what's next for Resurgence? I'm going to be honest. I have no idea. I really don't know. I am participating in interviews, and I am open to opportunities I'm not sure whether I can keep this alive by myself or not. I wish that I could, because I know that there are so many people out there who are telling me, but we need you. We need your services. What you do is above and beyond what we can get anywhere else. I know. That's why I built it. But in order to stay open, there's a couple of things that would have to happen. And that's a big if. If I decide to continue on as Resurgence, it will be just me. By myself, I will have to go out of network with all commercial insurance. I will not have the time to fight the constant denials and rejections. I will not have time to chase my money, because I will have to see a lot of people during the day in order to make enough money to continue to stay open. So I would have to get rid of commercial insurance. I would only keep Medicare and VA community cares. And then the challenge becomes rent. Where do I go? I still haven't figured that out yet. A lot of people suggest mobile outpatient, but me going from home to home all over Charlotte, the reimbursements are not going to give me enough to pay for the gas, the travel time, and my wage. I can tell you that right now. So the key of having a mobile outpatient business and being profitable is keeping your radius small. And so I don't feel like that is a good option unless I could find a place to set up shop and see a few people, and then move to another place and set up shop and see a few people. But for every minute I'm on the road, that's 1 minute that I'm not seeing a client, and that's 1 minute that I wouldn't be getting paid for. It would actually be costing me money. So the possibility of staying open is pretty slim. And that also makes me really sad, because I've worked really hard. I have worked really hard to build what I built, to gain the reputation that I have within this community for quality of therapy. But this, at the end of the day, is not about my ego. It's more about the fact that we take on professions and jobs not just to fulfill us emotionally, but to also pay our bills. And at the end of the day, that is what I have to prioritize. No matter how many people that upsets or leaves in a lurch, and I hate it, but I've got to take care of me. I have to take care of my family at this point. And I hope that at some point soon we can revisit Resurgence Neuro Rehab, or I can be put in a position with a company that has a lot more resources and a lot more money to where I can build this program for someone else and sit in the satisfaction that I still built it. It doesn't matter who I built it for, I built it. I built it for the clients, right? But anyway, so that is what the future is looking like. It's a whole bunch of, I don't know. I really don't know, and I wish that I did, and it's very unsettling that I don't know, but I don't know. I just don't know. So the one thing I do know is that I still want to continue this channel, because I feel like advocacy is of the utmost importance, and not enough people know how to navigate the healthcare system. Not enough people know enough to understand what's coming. And so what's coming, I will tell you, what is coming for the future of healthcare is more and more smaller businesses are going to be going out of network with commercial insurances because of the prior authorization requirements and because of the low reimbursement rates. It's taking up too much time and costing, we have to pay an administrative staff to do all of this stuff. And if we don't have the volume, if you don't have the volume of visits, it's impossible to be profitable. So just, y'all, keep your ears open, and again, look for that PPO plan where you can have out-of-network benefits And also, open enrollment is closing. I hope you all stuck with Medicare and found a supplement or a secondary insurance to help you. Yes, it does cost more, but the coverage is better. Think long term, not short term. We're playing the long game here. So, I don't know what else to say about it other than I feel terrible in more ways than one. But this is the reality of the situation. And, I hope that whatever opportunity comes up next for me allows me to have a place where I can do my community outreach and education, because I love doing that. And it allows me to build a program that's multidisciplinary that will allow us to collaborate and focus on patient outcomes and satisfaction and what really matters most to the people walking through our door. So with that being said, I will be heading out of town to help a family member trying to navigate the healthcare system. So I will be back in touch and hopefully have some fabulous content for you on this channel, and that will bring you value and insight for your healthcare journey, no matter where you are in that process, or whether it's yours or your family's, a family member, a loved one, a friend, whoever. I just hope that I can help you. So with that, I will see you later, and until next time.